Probably the most important thing for patients to understand is trying to understand the balance that we have to play both with efficacy as well as toxicity. I think fundamentally patients are most concerned about the disease, and they're willing to consider therapies that come with a high price in terms of toxicity without probably understanding the potential impact of those toxicities very well. And I think a lot of what we do from an informed consent perspective is trying to highlight some of those limitations in terms of what we see with toxicity. Again, transplants are very safe in this day and age, particularly autologous transplants, but there still is a risk of death associated with those procedures, again, that you can potentially modify, or you might suggest patients, again, of poor fitness may need to avoid those types of treatments. What we're seeing with more novel treatments, some of them are phenomenally safe and are very easy, I think, to treat across a broad spectrum of patients, such as PD-1 antibodies. Treatments like CAR T cells are certainly much more selected, given the fact that the toxicities you do see, a fair number of patients will require stays in intensive care units, will require hospitalization for some prolonged periods, and I think watching how that type of treatment evolves, moving out of controlled environments and research studies and big academic practices as they become approved and available more broadly, I think we're going to see a big learning curve for some practices, and I think that's the other lesson in all of this. In clinical trials and controlled environments, risk is taken, and that's part of what happens to develop therapy. And unfortunately, I think it's important to remind patients about that balance of understanding risk-benefit.